I won $25,000 in a national science competition by designing medical AI that can support global healthcare outcomes. Hi, my name is William Gao. I am a senior at Centennial High School in Ellicott City, Maryland, and I am a 2024 Regeneron Science Talent Search finalist. For me, my research interest specifically sprung out of a family history with disease. My grandparents lived in more rural regions that lacked robust medical infrastructure. So 3 of my grandparents were eventually diagnosed with cancer, but poor healthcare meant late diagnoses, and late diagnoses meant grim prognoses. So I never had a chance to meet them, but certainly hearing their story from parents or from friends brought me to awareness of broader health inequities that persist around the globe today. And that became the catalyst for my research and for the work that I'm continuing today. Specifically, I noticed that shortages in trained pathologists around the world cause long diagnosis times, especially in developing countries, which in turn results in elevated breast cancer mortality rates. So to tackle these healthcare disparities, I developed an AI diagnosis tool applicable on mobile devices that can support doctors in this diagnosis process and ensure more equitable healthcare outcomes. This system is meant to be applied to support pathologists and to support hospitals in the diagnosis process. So what a doctor would do, for example, is if they have a tissue sample they want to diagnose, they can use the model to scan that tissue sample, and the model would output a heat map that shows areas of high cancerous probability. The pathologist can analyze these areas of high probability and then be able to make a diagnosis based on the information. And this really speeds up the process because now the pathologist can already know where those hotspots are and then take a look at those areas to confirm whether or not it is actually malignant. Certainly here, I've really focused on breast cancer, but I also think that this system can be applied for a variety of other medical AI. As long as we understand the disease nature, we can use it to create diagnosis models for a multitude of diseases while still keeping that idea of using data from a variety of medical centers in creating globally spread AI. For me, I see a space in the venture space and in the entrepreneurship circle really working to see if I could create real collaborations and see how the system would be applied in the real world. And ultimately, I do hope that it can be applied in developing areas or areas around the world which can create a real impact and really have an ability to support patients around the world.